At MARC, we understand that addiction is a chronic disease that manifests itself uniquely for each patient, and that each patient may respond to various treatment approaches differently. While we focus on individual differences, we also know that our patients often have much more in common with one another than they initially are open to seeing, and a common thread runs through all their stories: disconnection. Disconnection from self and from others. Too much focus on differences can reinforce a belief of otherness that keeps a person unwell by promoting an idea that they can never get better because their story is so different, better, worse than everyone else's. At MARC, we strive to balance providing individualized and personalized care with treatment approaches that we feel benefit everyone. All of our patients exhibit patterns of behavioral and emotional symptoms that interfere with their living authentic and fulfilling lives. Our methods help to uncover the link between emotions and actions through therapies that foster revelation, empowerment, resiliency, and growth. Addiction and co-occurring psychiatric conditions are addressed simultaneously through an integration of a diverse array of therapeutic services. The MARC clinical team is comprised of 10 master's level clinicians and a drug and alcohol counselor. Each therapist has different strengths and interests that inform their clinical perspective and interventions. Patients work closely not only with their primary therapist, but several members of the clinical team, offering exposure to a variety of therapeutic modalities that all adhere to the MARC philosophy of treatment. Our primary mode of service delivery is through group psychotherapy. Because of the isolative nature of addiction and other psychiatric disorders, and because so much of the maladaptive behaviors stem from interpersonal wounds, connection to others and interpersonal healing is necessary. Group work plays an instrumental role in reducing shame and is an ideal place to confront the denial that feeds unhealthy coping mechanisms like substance use. Group members learn to establish healthy, reciprocal relationships with one another, as well as how to give and receive critical feedback, as well as confronting and exploring the here and now processes that unfold in a group dynamic. Most individuals receiving treatment for addiction and co-occurring disorders have a history of trauma that relates directly to their current thoughts, feelings, and behaviors. For this reason, MARC delivers trauma-informed care to our patients, meaning that all members of the clinical, medical, and direct care teams approach those we serve with the understanding that their trauma histories require our awareness and respect. At MARC, information and education about trauma and its impact is interwoven throughout the treatment experience. Within this overarching framework, some patients also participate in trauma-focused treatments in both group and individual settings. At MARC, patients may participate in the following treatment modalities: ACT, CBT, DBT, EMDR, brain spotting, psychodynamic psychotherapy, Gestalt therapy, experiential activities, relational trauma repair, and psychoeducation, primarily on the brain, attachment, and trauma. Our therapists typically do not strictly adhere to one treatment modality, but offer a blend of treatment approaches to best meet the changing needs of their patients, while providing services within their scope of practice. As one of the guiding principles of MARC, we also believe that appropriate and effective addiction treatment must include family work. Through work with the MARC clinical team, as well as outside resources, family members are supported as they embark on their own recovery journeys. Family members explore patterns and behaviors that contributed to unhealthy dynamics in the family system, and work to establish new family norms that support health and recovery for everyone. At MARC, we believe that a patient's opportunity for success in recovery is best supported and enhanced when their family members are also seeking to heal the family system. So family members are engaged immediately and participate with their loved ones in the treatment process. Through this dynamic approach, we also know that time is our friend. Addiction being a complex chronic disorder, we are fortunate here at MARC that we have the time with patients to fully work with them, walk with them in the early stages of their recovery, support them when they succeed and when they may stumble, so that they learn how to live in recovery. It's this long-term community reintegration model of care that we believe truly sets patients up for a life of success.